Hi, I'm Michael Lind. I'm the Policy Director of the Economic Growth Program at the New America Foundation. And I'm speaking today with Jacob Hacker, author of The Great Risk Shift and other books, a fellow at the New America Foundation, and a political scientist at Berkeley. We are here to talk about Professor Hacker's very influential plan for a public healthcare plan to compete with private insurers. Jacob, can you explain that concept first?
Sure. So the idea is basically that you would have public insurance plan that would be inside some kind of new national insurance pool that would be competing with private plans within that pool. You know, it's not so different from the current Medicare program, which has public Medicare and then private plans that compete with Medicare, but it would be set up in a way that worked much better than the current Medicare system. So the private plans would have real incentives to compete with the public plan. They would be competing on a level playing field, and there would be some separate body, the pool basically, that would regulate the competition between the two.
And the idea is that the competition would drive down the prices of medical services in cases where they're arguably are overcharging for pharmaceuticals, for doctor services, and other things. Is that correct?
Yeah, I mean, that's one of the key guarantees that the public plan would provide, that there would be real emphasis on controlling costs over time. And as I've shown in some of my previous work, Medicare, for all its flaws, has actually done a better job in recent years of holding down costs. But I also think it's important to recognize that this would be a benchmark, that it would be available in all parts of the country, and that it would also be able to provide a pressure on the private plans to do a better job being transparent and stable and collecting information about quality.
But let's be clear, anybody could enroll in this. Medicare is age tested,
Right.
Medicaid is means tested.
Right.
But any worker between 18 and 65, 67 could choose to enroll in the public plan rather than an employer-offered plan.
Well, it's not exactly that clear, because the way in which the proposal I put forth and the proposals on the agenda work is that if your employer provides health insurance, then you get coverage through your employer. So it's very important that, as President Obama and others have stressed, that we're not taking away people's employment-based coverage. If employers continue to provide it, you should be able to enroll in it. However, if your employer doesn't provide coverage, then you would have the same access to this new plan as anybody else whose employer doesn't provide coverage.
Now, which employees would this chiefly benefit? Small businesses are less likely to have employment-based insurance than big businesses, are they not?
Yeah, the two groups that it would most benefit are smaller employees who work for smaller employers and lower wage workers. The reason it would help lower wage workers is that in most proposals, the amount that an employer would pay to help enroll their worker in this new pool where they could get the public plan or private plans would be based on the payroll. So if the payroll is relatively low, then employers will see that as a better deal for their workers.
What are the arguments against your plan?
Well, lately there's been a lot deployed, but I think the main argument, the main concern is that it won't be possible to have a level playing field between the public plan and private plans. There's a lot of concern that the public plan would, for example, bargain too aggressively for lower rates, and it would shift costs onto the private plans. There's also concern that the public plan would, say, be able to draw on general government revenues so that it would be sort of unfairly subsidized. But my proposal would deal with both those concerns. I mean, first of all, the public plan would operate just like the private plans in the sense that it would get subsidies for low-wage people, but it would have to run like a private plan in the sense that it would get money in and it would have to pay money out. It wouldn't have free access to general government revenues. And also, the same rules would apply to both the public and the private plans. I think that the main area of dispute, therefore, is really, should we have a public plan that has the authority to bargain for lower rates? We can negotiate what exactly the public plan would pay at the outset, but I think it's really crucial that the public plan does have that authority, because the fact is that it is the runaway prices in the medical sector that are driving up premiums. We have had huge consolidation of providers over the last 20 years, and that means that there's been very little effective pushback from insurers, and we've seen skyrocketing costs. And the number one way that we could reduce the rate of increase over time is to have some countervailing power in the market, as you said at the outset, making sure that prices are reasonable.
How does this affect trends in employer coverage? There's been a trend over the past decade or two for employers to cover fewer and fewer workers in the workforce. Do you see the public plan absorbing an ever-growing percentage of workers as more employers offload their workers to it, or do you see perpetual sort of competition between them?
Well, I mean, this is another area of controversy, but my view is that you want to distinguish between what the one-time effect would be versus the change over time. There are some employers, particularly those who have very low wages and are struggling to provide health benefits now, and the smallest employers that try to provide benefits, for which it would be a good deal to have this new pool, and they might enroll their workers in it. But that's probably not going to be a major shift. So most employers that are happy providing coverage now should be happy providing it in the future. In fact, a lot of the measures in healthcare reform are designed to make it more affordable for employers to provide that coverage. Over time, I think it's going to really depend on the larger trend in employers' willingness to provide health insurance. You're right that over the last generation, we've seen a big decline. In fact, since the recession began, estimates are that 9 million Americans have lost employment-based health insurance. We've seen maybe a 10 percentage point decline in the share of employers offering coverage since 2000. So it would take a very dramatic reversal of that for employers to start being more willing to provide coverage. But I think we may see a stabilization, because if this overall system works properly, then there's going to be this competitive dynamic that will help encourage all actors in the system, employers, private insurers, and the new public plan, to try to focus on value and hold down costs.
Well, your plan has been widely discussed, and it's won a great deal of support, particularly among progressives. What do you think the outline of the Obama administration's plan will be as it evolves in the future? And do you think it will incorporate elements of a public plan like this?
Well, it should be said that during the campaign, President Obama embraced this idea of having a public plan compete with private plans. I think wisely, the Obama administration is now trying to steer clear of making specific kind of litmus test arguments for one element of reform or another. But I know that they're working very hard behind the scenes with congressional leaders and encouraging them to come up with good packages that can gain support in Congress. And I see no sign that they're backing away from the idea of having a public plan. There's some debate about what form it would take, what kinds of rates it would pay, but I see no sign that they're backing away from that. The important thing is that in the House in particular, there's just very, very strong support among Democrats who believe, as I do, that we've had a system that's lacked accountability, and you need to have the public plan in there as a source of accountability in the system. So it's a really important element to many Democrats and progressives, and they're going to push to have some form of a public plan in a final reform package, and that comes out of the House. But this is going to be a big debate, and we'll see what happens.
Well, we may have you back in the future to discuss the developments.
Well, I very much hope so.
Well, thank you. Jacob Hacker.